Penicillins have 3 shelves dedicated to them in the pharmacy. A shelf for the repository form, anti-pseudomonals, and one for the semi-synthetics. The chemical difference in these drugs are only their R structures. These penicillins are great for patients with gram-positive diseases, meningitis, pneumonia, strep throat. You use Pen V for that. Gonorrhea, you use Pen G for that, where they switched to the ceftriaxone because of resistance. Syphilis, they'll use benzathine for that. And for 2 derivatives of Clostridium, they'll go ahead and use Pen G for that. The semi-synthetics hold drugs that can overcome staphylococcus resistance. So, if they have staphylococcus, you wouldn't want to give them an anti-pseudomonal. You wouldn't want to give them a repository form. You want to give them a semi-synthetic one because these were made specifically to fight against the staphylococcus resistance. These drugs, some of these drugs include methylene, oxacillin, naphthalene, and methicillin. So that's what the semi-synthetics are for. The anti-pseudomonals and ampicillin, amoxicillin have action against gram-negative bacteria as well. Anti-pseudomonals can treat bacteroids, Klebsiella, but ampicillin and amoxicillin can treat Salmonella, influenza, and Shigella. The ampicillin and amoxicillin are great because they're rapidly absorbed. So if the patient was in an emergency situation and they needed to get rid of a salmonella, give them ampicillin. Penicillins are beta-lactams. They inactivate the cell wall biosynthesis of an organism. That's what penicillins do. If you want to be paid in gold, take the over 90 rule to heart. These drugs will excrete rapidly within 30 minutes or so through the kidneys. There are special cases where the repository form will be given to avoid fast absorption. Procaine Pen G stays for 12 to 24 hours. That's one of the repository forms. Another repository form is benzathine, which stays for almost a week. So that's what repository forms are good for. They're good for delayed excretion. Anti-pseudomonals good for they have the broadest spectrum. And semi-synthetics are good for overcoming staphylococcus resistance. So there is naphthalene also, which is a semi-synthetic one, which is actually excreted through the bile. So that's another way that is different, because they're mostly excreted through the kidneys. And probenecid is actually given if you want to stop excretion of penicillins, period. So if there was a reason why you would want to delay, you would want to maintain that dose for a given period of time, you would give probenecid. So make aware to the patient a few side effects that can happen before they leave the pharmacy. Seizures, if they have a large dose. If you give them like 1,000 milligrams of penicillin, that's a pretty large dose. They can have a seizure. Be aware of that when you give them to the medication out the pharmacy. Hypersensitivity reactions, which is the normal type of reaction or the normal type of side effect they would have. That would be, fevers, chills, itching. And when treating syphilis, and you would treat syphilis with benzathine, and an inflammatory reaction called Janus-Henmeyer may develop, which causes headache and sweating. So if you're treating syphilis, know that can happen. Of the semi-synthetic penicillins, naphthalene is the most toxic, but is also the most potent. It's like the last choice you use, but it's the choice that you know is going to get the job done. Either that or nothing going to work. The first one of this class was penicillin, but they remade it so that people can take pills. Before you would have to only take IV, so they remade it into oxacillin and disoxacillin, so that you can take it orally as well. And it's good that you listen to the notes, but go read the notes and you'll see exactly what I'm talking about. This is just it just helps you to see yourself using this shit in the pharmacy. The first one, well, I already said that. Anti-pseudomonas just provide a broader spectrum. I already said that. That's the specialty of that class. A doctor can prescribe this for gram-positive and gram-negative diseases. That's what a broad spectrum means. Penicillin is one of the anti-pseudomonas. It's the broadest spectrum and the most potent, taken IV. Carbonicillin and tiericillin are similar, but carbonicillin is less potent and can be given with a pill. Tiericillin is like penicillin, has to be taken IV. To avoid beta-lactamase, which is what causes the resistance of the penicillins, we can give them with drugs called sulbactam, tazobactam, and cluvenate. They combine with the penicillins to form these drugs: augmentin, timentin, and unison. I'm gonna repeat these. Augmentin, timentin, and unison are just the combinations of the beta-lactamase inhibitors and the penicillins. It helps to negate any type of resistance a bacteria would try to have against the penicillin. They have similar half-lives to the penicillin, 30 minutes. They just to stabilize the ring of beta-lactamase, and it's irreversible. So I give a patient 50 mg of augmentin that has to be taken for one every 24 hours. I know that it won't be resisted because the bind that the sulbactam combination will create will destabilize the beta-lactamase completely. So now I know the therapeutic dose will do its therapeutic job. So once again, if they have MRSA, nothing will work. So whoever makes a penicillin that can work against MRSA will get paid in gold.